Hello, everyone. Welcome to this week's COVID-19 update. I'm James Milan, and this week we have back again with us our Director of Health and Human Services in town, Christine Bongiorno. Christine, um, I would say how you doing, but I can't imagine it's great. I don't know. How are you?
Uh, Great is an okay term to use today. Yeah, no, we're doing well here in the health department and health and human services. Just coming off a pretty busy week, busy few weeks, I should say, with just planning for vaccinations and executing our plans. So.
Right. We do want to ask you about how the vaccination rollout is going, because, of course, that is topic number one in a lot of ways, but underlying that and always present and always needing to be updated is the latest on the data here in town, and not just what's happened recently, but where you see things going.
Sure. So I can start with the data if that works. So
Please do.
we're over 1,400 cases since the beginning of March last year here in Arlington. Again, the death rate it's somewhat steady. We've had a 5 deaths since the beginning of the year, unfortunately. So we're up to 73 deaths. We've seen that slowing slightly, which is a good sign. I think it really shows that the vaccination of our 3 senior long-term care facilities and assisted living facilities has actually been helpful. We haven't seen any cases in those 3 facilities since the beginning of January, which is when I believe the vaccinations were conducted in December at those 3 sites. So that's promising. Something that we're really eager and excited for, to see that those cases sort of not happening in those locations. So I mean, I don't know if you want me to transition over to vaccines. I've got my vaccine numbers. I think we can probably.
Well, absolutely, we will in a sec, but I do want to, I assume that, your message to the community, though, despite some brighter signs there, and that's definitely good news in terms of our elder care facilities, since they have been such a nexus here as in elsewhere of deaths from COVID. So that is genuinely good news, it feels like. But I know that you've got, the usual sobering message to deliver to the community, because, things are hopefully looking brighter, but we are so far from out of the woods, it feels like.
Absolutely. And so with the number of cases sort of decreasing at our elder facilities, we definitely are seeing the 20 to 30-year-old to 40-year-old population continuing to contract the virus. And so that's really where a lot of our efforts are placed at the moment. And we do want to remind the public to continue to remain vigilant, because as we see new strains, as we see the variants circulating in our in the world, and then being picked up and brought to our communities, we could see a lot more cases. And so gatherings, those types of events that people are continue to go to, private household events, will continue to many cases. When I looked at our data just this morning, just to be able to be prepared for our conversation, I noticed that there were a lot of, it continues to be a lot of, complete households in our data. So, 5 or 6 people from one household. And so we're still seeing that. So one person may be going to an event, coming back and spreading it to their entire family unit, including older family members, which is of concern for obvious reasons. So we do urge the community to remain vigilant. Despite the good news about our senior facilities, we still have a number of seniors in our community that are unvaccinated and not protected at the moment.
Yes, unvaccinated and not protected at the moment is a good segue, because when we got to speak to you a couple of weeks ago, that was right on the heels of what had been a successful first week of vaccination for Arlington in combination with Lexington and Belmont. And you were eager and ready to get going with more, up to 1,000 even a week. However, since that time, state has announced that they, were distributing 100 vaccines per community per week. What can you tell us about just the experience so far, and whether you expect things to be getting better or not?
Yes, it was about a month ago that we started the vaccinations here in Arlington with our first responders, and since then we've done about 1,200 vaccines, first doses, and we'll start our second doses beginning next week for this first responder group. We're a little frustrated. Not going to lie, I'm not going to sugarcoat it. We're extremely frustrated and quite upset that we're not receiving the number of vaccines necessary to cover our population. We do understand that there's a supply chain issue from the federal level to the state. However, it has been made clear by the state administration that the local boards of health, where we had originally thought would be the source of vaccinations to our communities, will not be the major source. So the state is really looking to push people into those mass vaccination sites. So the Gillette site, Fenway, there's a site in Danvers, and I believe there'll be a site in the Cape and possibly Western Mass as well. But that's
Yeah, and I
really,
heard, sorry to interrupt, but
yeah.
also one in Springfield, which I was hearing earlier today from some seniors. There seems to be quite a bit of availability at that particular site.
Sure. Yeah, I'm sure there are.
Mhm.
It's probably a new site online, so there's a lot of availability, likely. So yeah, we are definitely frustrated at the local public health level. I think it's a pretty unanimous feeling across the state that here we are with our plans that we've been practicing for almost 2 decades to dispense vaccinations in the midst of a pandemic. We're in the pandemic and we're waiting for the vaccines. Our community members don't understand the the lack of vaccine from the state to the local public health departments. So the frustration, really, we're answering phone calls from people that are they're trying to make their case for a vaccine, and we just don't have it. And so I think that the message to our community is we're fighting for them. We're just as upset and angry that we're not getting the vaccine to be able to provide the vaccine locally. We know our cases are in our older population, and it's a really difficult population to get to Fenway. To expect an 80 or a 90-year-old to get in the car or to first go online and get an appointment to access a vaccine, make an appointment, get in the car, go to Fenway, find a parking space, and then walk from their parking space to the location is in my opinion, it's unfair. I think that that is definitely a site where mobile, people that are mobile can certainly access, people that are in phase 1, the healthcare workers, first responders that weren't covered through their local communities. But it is unfair to consider that as a site for our, we had a 104-year-old at our clinic yesterday. The mobility issues that we witnessed were more than could be handled at a mass vaccination site. So I think that it is, in my opinion, irresponsible for there to be a lack of vaccine provided to local communities to get to the most at-risk community members, and those being the 75 and over population. We continue to hear frustration from others that have major comorbidities, people in the 65 to 74-year-old population. And again, it's right now the state phase 2 category 1 is the 75 and over. And we have decided here in Arlington and with our partners in Lexington and Belmont that our 100 doses per community will go only to the 75 and over population. We've decided that all of the healthcare workers and others in phase 1 that we maybe didn't cover during our previous clinics will be asked to go to those mass vaccination sites so that we can really focus our efforts on those 75 and overs.
Yeah, those are tough calls that you guys are having to make, and certainly, thankfully, I'm still a ways from 75 myself. But as you described it, those mass vaccination sites, that's daunting to me to think about all that it would take to go and do that. So, yeah, you're absolutely right to zero in on the fact that that's not serving the literally that population of people that we're trying to get the vaccine to as soon as possible. Uh, I'm wondering whether, in terms of vaccine availability or in general, in terms of the overall prospects for vaccination picking up, whether the new vaccine from Johnson and Johnson, which is currently being reviewed for emergency approval by the FDA, could that make a difference? How does it compare with the Pfizer and Moderna vaccines that are currently in place, and does it, is that a reason to be hopeful?
Absolutely. I think with a new vaccine coming online, a vaccine that's much easier to to administer. It's much easier to access. It's a one dose vaccine. It's very similar to the flu vaccine, so we would refrigerate it. It's a different type of production, so it is a much easier vaccine to distribute among a population. We are hopeful. It again really we will rely on the State Department of Public Health on whether or not we will be accessing that vaccine. And again, I think, we would like for that to be the vaccine that is shipped out to us to be able to get to our, our other populations within Arlington. But, I think we're just going to have to wait and see. But it is an easier vaccine to distribute, that's for sure. And I think when we look at distribution of vaccine around the world, I'm hopeful that that vaccine will make its way to those countries that maybe don't have, a lot of access to freezer space, and it's a much easier vaccine to transport and to administer. So it's for locations with limited freezer space, it's a much better product. So.
Yeah, I'm very glad that you brought that last point up as well, because we are understandably and justifiably focused very much here hyper locally on what's happening in Arlington. But really important that the Johnson and Johnson vaccine, which has been called a potential game changer, I've seen in various sources, could have such an effect, not just here locally, but globally, for the reasons that you mentioned. So we shall keep fingers crossed that things proceed smoothly, or as smoothly as possible, with the rollout of that new vaccine. Anything else that we missed, Christine?
I don't think so. I think you've asked all the questions for the week. Happy to come back in a few more weeks and give you updates. But yeah, again, I think we are just very eager and excited to be able to continue pushing forward for fighting to access vaccine, and just helping our population access the vaccine, whether it's here or our veterans. We're pushing them to the VA in Bedford. Our seniors, we're urging them to contact the hospital systems that they're part of, so that we can really try to improve our access beyond the 100 doses we receive. So, in Health and Human Services, so there's the Health Department and Council on Aging, Veteran Services, and the Youth Counseling Center. We're always, we're working together to make sure we're covering all areas of our population, particularly those most at risk. So, we'll just continue as a team to make that happen, and hopefully in 2 weeks I'll have better news.
Absolutely. I mean, I have referred to it often in the past with you, but nobody knows more in this town about the overall situation and the specific constraints and challenges that we are all facing than you do. So we really do appreciate your taking the time to share that with us. And we are very hopeful that the next time we speak to you, be it 2 weeks, 4 weeks, whatever it is, that we will have brighter news to share. And, I look forward to that. I'm sure you do even more.
Absolutely.
I have been speaking with Christine Bongiorno, who is our Director of Health and Human Services here in town. This has been the COVID-19 update for this week. I'm James Milan. Christine, appreciate you being here. And thank you for tuning in out there in the audience. We'll see you next time.